Good morning, and thank you for that, and thank you very much indeed for hosting this important meeting. Just before we start, just to say that unfortunately, Doug Campbell is not able to be here today. You'll see that he was going to be talking about the wrist. I'm very disappointed, but I'm very pleased to say that Roll Bars has agreed to step in to his shoes and talk about the wrist. No, fortunately, Roll, you're going to be talking about how to prepare your athletes for major games. So if you just note that in one of the later sessions this morning. Yes, I'm Roger Hawkes. I'm president of BASM. I was also an instigator for the Golf and Health Project. Early on, people said it would never catch on, but I judge from today, I think they were wrong. The first International Congress on Golf and Health set out our stall. We established golf as good. We published in peer-reviewed journals the evidence, and that was that. And we thought, well, that's it. Well, we didn't really, because we challenged all sorts of people. We challenged players. We challenged policymakers. We challenged the golf industry to maximize those benefits and to minimize the risks. And today we're going to be talking about where we are. But perhaps more important, where do we need to get to? What do we need to do to make the greatest impact? And I'm very pleased to say that we've got a very good lineup of speakers early on in the day in my session till towards lunchtime. And we're going to be hearing from them about the challenges and how they see ways that we can move this forward. Enough from me. Our first speaker is Fiona Bull, who's going to be talking about the Global Action Plan on Physical Activity. She needs no real introduction. She's head of physical activity for the World Health Organization, based in Geneva, just moved out from Australia. Let's welcome Fiona Bull.
A very good morning to you all, a hot morning, and it's fabulous to see this start and build on, I agree, a very enjoyable evening last night where the conversation started. For those of you there, it was certainly a very special occasion. Can I open by thanking and recognising first the Honourable Minister, thanking the RNA, thanking the Royal College of Surgeons for hosting this event, and extending my thanks and congratulations to Paddy, to Roger, to Andrew, for pulling us together and taking the leadership to put the focus on how sport can contribute to health, and to put the focus on how golf can contribute. So as a discipline, sport, as an international federation, and as, of course, the home of golf, I think this is rather unique. I would love to see other sports take the initiative, and perhaps your leadership will encourage others to do so. I've been asked over the next 15 or so minutes to put some global context on this day and set the scene with the global physical activity agenda and our work at WHO on promoting physical activity. It may be familiar to some of you, but also new to others. So what I plan to do over the next 15 or so minutes is set the scene of physical activity, look at this thing I'm referring to as the Global Action Plan, discuss how we, and I say we very genuinely, we at WHO, we as a sport community, we as a global community are implementing it for all the benefits that you are here to, and know about, the benefits to health, and then of course look at the opportunities for sport specifically. So let's get some numbers out of the way pretty quickly. Leading cause of death is chronic disease, non-communicable disease. That's the heart, diabetes, cancers. They are accounting for 70% of deaths. 41 million deaths and counting are occurring each day, and 15 million of those are preventable. They are occurring within an age bracket that shouldn't happen. Shouldn't happen when we know the evidence and know how we can prevent it. So WHO has a priority on reducing non-communicable disease, and particularly the premature cases. We've said this for some time, and the bottom of this is just showing a little reflection, and some of you may well have been on this journey. Does anyone recall back in 2011 when there was a high-level meeting in the UN General Assembly of New York? the first high-level meeting on non-communicable disease, the second only on a health topic. The first was on HIV a decade earlier. In 2011, we said it was important. We met again in 2014. By 2018, we were saying it's time to act, time to deliver, time to do something, time to put what we know into practice. And I'm afraid to say that we've also met again since then, and we will meet again in 2024. Our eyes are set on 2030, but there is an element of frustration you might sense in my voice and perhaps amongst many of us. We do know what to do, and so we have to challenge ourselves on what is stopping us getting these excellent interventions and practice, policies, etc., into the communities and into our societies. So I've already really referred to this. I've mentioned the key contributors, and there are many more, and I will mention, of course, the very important area of mental health, which is the subject of some sessions today. These are just calculating and reporting on some of those leading diseases. A rather shocking slide. Two things stand out at you. It's a flat line, and it's a long flat line, because that's the trend since 2001, estimated with colleagues here in Scotland helping us do this work, looking at global levels of physical inactivity. The proportion of the population not meeting the global recommendations, which are the same as here in Scotland and across the UK. The second thing you see is the gender difference, also consistent and not narrowing. So we have a global challenge. 1/4 of adults do not meet the recommendations. That means they're missing out on those benefits. And Roger, in the introduction, we're trying to reach them and engage them in being more active through all ways, and sport and golf are certainly one of those. The flat line and the difference between men and women is certainly something that WHO is placing a priority on, addressing the inequalities. Unfortunately, the inequalities do not stop just with gender. We know in most countries, Scotland may buck the trend, but we know that the activity levels decline with age. And I know we're going to hear how wonderful golf is about bringing people back to sport. It all sits within that big agenda of the Sustainable Development Goals, a global commitment, a global compact by 2030 to make the world a better place, a more even place, a more equitable place, a healthier place for both our planet and people. And boy, we've got some crises and challenges at this point. Around the world, our weather, the fragile communities, displaced communities, food insecurity, and of course, conflicts. Within that, we still have our eyes set on the global challenges, and particularly for WHO, we are custodians of SDG 3. This is the green one up there around 2 o'clock, and it is to improve health and well-being. And within that is our target, a target to reduce by 1/3 the deaths from communicable disease. And physical activity is sitting right in there, contributing and can contribute more to that agenda. And so, WHO produced a global action plan. If we're going to take that commitment into action, how can physical activity contribute? What do we need to do? What works, because we're evidence-based, and how can we address the challenges of that flat line I introduced, of that gender difference that I showed? And when I say physical activity, I'm talking about all forms of physical activity. And more, I use the words like walking, cycling, sport, because we need to name what we're talking about and encouraging people to go. But we measure all types of physical activity to assess levels globally. And we have the support from the highest level. You've seen this man on your TVs many times over the last 2.5 years, doing media briefings and updating us on the COVID pandemic. But on this occasion, he's holding a football as we launch the Global Action Plan in 2018. And his words are there. His words are that we must get the world moving more for the benefits that you are aware of and I'll speak to in more detail. But he also points to some of the challenges. It's going to take the political commitment. The policies need to be there. The resourcing and financing, the capabilities in the sports system, in the education system, in the transport system. In fact, he calls for a whole of society and a coordinated approach. It's not that we're not doing anything, it's just that we're not doing it well enough. And that's what we want to talk about. We also want to learn from what Scotland's doing. And I'd like to extend congratulations to Scotland and the communities here, the academics who are here too, and of course the government and the current minister, because I think we can learn a lot from Scotland and share it elsewhere. And I know you're very outward looking to learn from elsewhere too. So what is this global action plan I'm referring to? It's built on 4 strategic objectives, 4 policy or action areas, and they're big, bold colours. And you see the 4 colours here, and I'm going to take us through fairly rapidly, and if obviously those of you who are less familiar, if you want more information, and of course the document itself is on the website. So up in the top right, it talks about telling people about the benefits. We've got to share the news that physical activity is good for mental, physical, and social health. We've got to do it in creative ways. We've got to do it at sports events. And we were doing it over the last 5 days at sports events like golf and the Open Championship. But telling people and showing people these information and messages isn't enough. It isn't enough. We need to create the environments that welcome and encourage and are accessible and are affordable. So there is a lot of work to do. In fact, the environments shape our lifestyle choices. Can you cycle to work? As you quickly think about that possible journey, many of you may well already be cyclists. If you choose to cycle, is it convenient? Is it safe? Is it enjoyable? Do you recommend it to your neighbours and friends? We need to create the environments to complement the message that we're saying about get out and be more active and join in. But I'm afraid that's not enough, because we've then got to encourage people, invite people, provide those opportunities. And I've heard a lovely story over breakfast this morning about someone who's had their mind about golf shifted because of an enjoyable experience with friends, shaping and introducing others to cycling, walking, sport, golf, etc. And that is the yellow area. Provide the opportunities in schools and workplaces and settings so that people can come in and try. Find their sport. And then that's not enough, because we need to make sure it doesn't rely on individual people, a moment in time of one policy. A government changes and it's gone. The funding was last year, or just a grant. That's not taking this seriously. We need policies that set up with targets and commitments, resourced capacity. In Royal Colleges, we hope that training includes the importance of physical activity, pre-surgery, post-surgery, to prevent the surgery. And we need to make sure that across the relevant policies, physical activity is recognised. So the 4 pillars provide a scope of work, but they are action-oriented and evidence-based. And when you bring them together and unpick those 4 pillars, there are the policy actions that WHO, from consultation, recommends. And they're in each of the circles, and the circles add up to 20. And I always say, and I'll say again this morning, it is the lines that join them. It's not just one. It's building in Scotland, in Glasgow, in Edinburgh, in towns, and around the world in all countries. The approach to physical activity will require these different components coming together. So all the sectors are working together, and we call that a whole-of-system approach. So I've already mentioned up there, the top right, the communications, and we know how to do that. We can use leading figures, politicians, sports stars. We need to use the media, but we need to be creative. Old media, traditional media, new media, and social media. We don't know all the answers. That's where innovation comes. That's where still there's a research agenda. But we've got some good principles to build on. I've already mentioned the environment, building it right. So there's cycleways, the public open space is kept, the community golf courses are valued and retained and accessible. And then we have to have all of these things happening in this area. I've briefly mentioned some, but of course we're here today and this conference around the role of sport to that contribution. And then lastly, I've mentioned the policy areas. So the policy may be less familiar, but a good policy at national level saying it's important, and then linking and making sure it's in the education policy, the sport policy, the health policy, sport for all, of course, and transport. Measuring. If we don't measure, we don't know how we're going. We don't know if we need to do more for certain parts of the population and certain communities if we don't measure well. We set up that Global Action Plan based on the advice and experience of some 20, 30 years now, and I'm pleased to say countries are recognising and starting to adopt. We're going to be looking at how much implementation has been done, very shortly launching what is a global status report. Our job at WHO is to help countries share this sort of information and then help countries implement what we've said. A lot of technical assistance, which really means we're sharing the advice on how do you get this done. So what have we been doing? Well, first of all, we identified quite a number of areas we needed to work. And on the left, a critical one was bringing people together. We still need to work quite hard to bring sport and health together, to understand we're on the same side, but we're part of a bigger picture. So ministers of sports, ministers of health, and what about when they're in the same person? Because then you've got both sides talking to each other, saying this makes sense. It's rare, but we've got to bring those, and transport and education. We have to work with capacity building, making sure coaches in sport and teachers in schools and those that make decisions and influence all the previous slides are on side and realising not to do everything, but to do their bit, own their bit and deliver their bit together. So we identified, I'm sure you've scanned on the left-hand side there, the sorts of things, resource mobilisation, so talking to governments about how we need to redistribute current funding and find new funding, whether that's from private sector, from philanthropics, from domestic budgets, and certainly international development money. We need to partner, and that means working and understanding each other, and we need to monitor. So our job at WHO is actually across all of these areas. A fundamental one, though, is that telling people about the benefits and telling people about how much and how easy it is to start and how more is better. And whilst many of you in this audience know there's a lot of science, this is one of my preferred slides. It says everything. It says everything because the green line shows that as you start to be active, the benefits accrue. The more active you are, the more benefits you get. And somewhere at the top, they might start to diminish in those gains. And we don't quite know that top point. But we know a lot about that red person sitting down. And we want to move people and onto that green curve. And many in this room are interested in that grey line. And we welcome that because we want to reduce injuries. We want to prevent injuries, and we want to be able to care for those when they occur. And you can see for the predominant focus, certainly of my work, the injuries are low when people are doing health enhancing, the amount and types of activity, including golf, that can promote health. We've got lots of resources on those, so I see many of you being very interested in that, and I hope you can see there's resources you can download and use, and we put together a video to capture this very quickly. Thank you very much.
Thank you, Fiona. What we're going to do is have questions at the end, if that's okay.
That's all right.
And, okay. Yes, please. Yeah.
Sorry, thank you for the applause for the video. I think we thought that might be the end, but let me just reach the conclusion. Maybe it is the end. But I would like to share with you, if you'd allow me, please, just the last couple of slides to say we don't just make videos. We make them so that you can use them to promote physical activity. We provide you with the tools that will guide. We are very looking forward to looking at developing a sport and health toolkit, how sports like golf can promote physical activity. I've already mentioned that we're going to be producing a global status report, a stock take on our progress, looking at how countries are doing and comparing and using that to mobilise more. And you're very much invited to join that on April 6th. And of course, we're here to talk about health and golf. And I'm very pleased to tell you that WHO has created a new initiative called Sport and Health. And we're working with all partners and all constituents of the sport community, private sector, philanthropics, IFs, IOC, and, of course, the sporting community. What and why? We want to use sport to promote health, use the events that sport offers, the reach that sport offers, and through sport and in sport, create more opportunities and promote health. We're doing that with a number of fairly high-profile memorandums of understanding and projects. We're getting our hands dirty by working in the field with organisations and discussions already unfolding with the golf community. We've got the FIFA World Cup coming up, where we're looking how that sport can reach many more and engage. I've seen what golf is already doing, and I thank for the opportunity to join you at the Open to see for myself how in and through an event you are promoting physical activity and, of course, other health issues, water and sunscreen, etc. But it's also beyond the event. So I'm particularly interested in the initiatives that I know are being discussed and already trialled and tested here about how we can get more children playing, more girls playing, more people with disabilities playing. That's our shared agenda. How can we use events and the power of sport to reach more people to engage and be healthier? It's not easy, and it's not obvious that just holding an event, whether it's FIFA World Cup, whether it's Wimbledon, whether it's the Golf Open, it doesn't automatically mean more people are more active. In fact, the evidence doesn't show that. So it takes planning, it takes commitment, targets, interventions, partnerships, collaborations, all of which the RNA and other sporting golf constituents are doing, and we encourage that and we want to learn from it. How can we make the events that are held, whichever discipline, leave a legacy and actually truly leave the legacy, not the rhetoric of more active people? We look forward to this discussion, and I hope it will unfold during today and beyond. Thank you very much. That's the aim.